In Kamuda Area Development Program, the empowered leaders mobilized themselves to seek support from the government and World Vision to upgrade Kamuda Health Center 2 to a Health Center 3.
Citizen Voice and Action is an approach that World Vision Uganda uses to empower and mobilize communities. In Kamuda, this approach was used to empower communities to influence the planning process both in World Vision and in government. The community leaders, together with the community, had a vision of upgrading Kamuda Health Center 2 to a Health Center 3. And through this, they sat down and saw what stakeholders can we approach. In those ones identified, they reached to World Vision, they approached the government. And both parties agreed to come in and facilitate the process of upgrading Kamuda Health Center 2 to a Health Center 3.
The outpatient became so small, so squeezed for the workers to work on. And even the patients, as they come when there are many, the place could not fit them. And when the time came for the rains came and blew off the roof. And from there we became stuck. We gave a report to the government. We agreed that we should use one of the houses for the health workers. And that's where we are working now. And the problem we are facing currently is the place where we are working is too squeezed for the health workers. And everything that we are having, we have packed them there. It is really a very small place. The community became very much happier when they heard about the structure. And they came together with a committee of the DP, and they shared views about the new structure. And then they also agreed happily and even harmoniously to raise some money to get the local materials as we see them now on the ground. And each family happened to raise 3,000 shillings after agreeing in the meeting. And what we have in mind is now, after the new construction is complete, that's when we shall shift and work from there.
Each month, World Vision Area Development Program that have a nutrition program hold a parish child day where health and nutrition services are offered to the community.
We have World Vision helping us in the programs of immunization, children 0 to 5 years, and then deworming of children also from 1 year to 14 years, then giving also mothers TT, and then even pregnant mothers, they are being examined. You know, most of them stay very far, but at least when they hear that organization like World Vision is around and they have come with other people to help us, they come in great numbers. Not only that, even they are being sensitized on nutrition, how to prepare a balanced diet. It is not only meat as they were told there, but at least you include greens, even fruits have to be there, and whatever, and they are happy. Previously, few could come to the health center because they were not sensitized. But you can even see with your eyes today, there are many. After sensitization like this, they come to the health center for health services. They were also taught about how to make porridge. So the midwife went out for follow-up outreaches. They were really making those things, preparing porridge for the children, and really bringing fruits and grains. You see. They are really benefiting.
Out of communities' empowerment of how to influence in planning and budgeting, one of the things they do is prioritizing issues. World Vision organizes a forum or a platform where those needs from the community can be addressed at the national level.
Since children are at the center of its activities, The organization recently facilitated a meeting between children and members of parliament. This was on the occasion to mark 20 years of the Convention on the Rights of a Child.
Many children have been sacrificed in Uganda, so that those who sacrifice us, they lead to the abuse of our rights, because we have the rights to live.
Children are facing corporal punishment, that is to say, they are beaten, they are given heavy works to do.
Get that person who has committed that offense. Murder him in front of people when they are doing.
The members of parliament listened to the children and committed themselves to taking action on issues raised.
I want us as members of parliament to consider this meeting tonight as a very, very serious meeting and rethink the interventions which we are doing for the children of Uganda. Let it not be another talk show here that we come to please ourselves when our children are lined up on the streets without food, when our children are being kidnapped and sacrificed, when the mandate is on us as the government of Uganda to protect these innocent children. We have heard from them that they are helpless and they cannot protect themselves. What is happening? Every day you read on the newspapers, a child has been sacrificed. It is ourselves who have got to come out, and we are lucky we have got so many FM stations. Let's use those FM stations to empower our communities, to empower these young people. You can see how they speak. If we empower them with information, then they will be able to get up and talk more.
This occasion is an important and reminder to all of us, whether in government or other organizations within the community or as individuals, that we need to treat the children well, to ensure that they are healthy at birth and throughout their childhood, to make sure they receive an education and that they are safe from harm wherever